Welcome. This is Share Your Story Renema, and I am your host, Dr. Perfecta, the Pain Healer. Share Your Story Renema features real life struggles women face with their health. It's a means to educate one lady at a time about several health challenges the women folk face, while emphasizing that they are not alone and their pain is valid, whether it is big or small. In today's episode, we will be sharing a true life story of a lady who had to write an important examination twice due to an avoidable health challenge which she dealt with for over a decade. Let's dive right into it.
All right. Thank you for choosing to share your story with us.
My pleasure.
All right. Okay, so tell us about your story. When did it start and how?
Okay. So basically, I started my menstrual cycle when I was in SS3. Yes, I think that was late because almost all my classmates were the start since just 3, just 2. But nevertheless, I was scared that it had not started, but it started sha. Anyway, so it's the first time it started. I didn't understand anything about this whole menstrual thing. So I had pains, so I felt it was normal. So I didn't tell my mom. I just went on, use pad and all. But with time, it was constant, like the pain. It was not just normal pain. I was in severe pain. So one of the things that pained me past was when I was supposed to write WAEC, and I think that day I was supposed to write physics. I'm a science student. I was supposed to write physics. I saw myself under my seats, like trying to find a place that is very cozy, nobody to touch me, and all. And that was how by the time I woke up, I saw myself at home, and that was how I missed physics for WAEC.
Wow.
So it was painful because I had to write WAEC again, and well, the experience has not been pleasant. It's just almost sometimes I just feel like, God, why am I not a boy? I don't have to be a girl. So that was how it started, and like that, so many things came up like that. Yeah.
All right. Oh, I'm so sorry that you had to go through all of that. I can't even imagine. Right. So other than that, is there something else that you had to deal with over time after that particular incident or experience rather?
Yes. Okay. So after that incident, I wrote WAEC again. It happened again when I was writing my second WAEC, but because it was a private school, so they had to. I'm not supposed to say this, but they had to help me, with this whole thing because I explained to them what happened the last time. So after that period, I had to keep taking medications. If I know it's supposed to start maybe a few days, I will go and buy this Buscopan, Pelvin. Yeah, there was even a time they told me I should take Flagyl and Andrew liver sauce. Yeah, something like that. So it was painful because every time I have to start my messes, I'm like, God, can it not come? Or let's just come fast, and then just pass. At some point, I had to start taking injections. Yeah, they give me injections before, 2 days before, and they tell me to be on bed rest.
Wow.
Sometimes I lose strength basically, and I just feel around that period I can't do anything reasonable. I can't go to work. I have to be at home so that people not start asking me what's the problem. It was just it was it was painful. It was painful. It was really painful. And then when people ask me, "Are you the only one?" Other people are seeing messages too now. Are you the only one? I feel like people understand what I'm going through. I had to Google check, say if you get pregnant, it will reduce. I'm like, you know what? Can I just maybe just get pregnant so this thing will just stop? But it's made you think of you're not ready. It's not right. I'm like, okay, let me just. I have to just bear the pain till the time is right. Just many emotional things going on in my mind, and it was painful. I must say it was really really painful. I can't even imagine. But thank God, I think the pain continued. But when after I met you and told you everything about my menstrual cycle, and then you're following me through, following me up with okay what to do, what not to do, and then you gave me that okay acupuncture on my
Yeah,
palm.
acupuncture.
Yeah, and I felt relieved. Since then, my message has been she comes just come and I'll be like, oh, let's come. Oh wow, it has finished. Okay, I didn't notice that kind of stuff, and
Right.
it has been good since then. I mean, I don't have to cry that oh my message is coming. Can I just skip it? But when you skip it, it's an issue too.
Yeah, yeah, exactly.
So thank God, it has been good.
Okay. So you've even covered many parts that I would have loved to ask, but you've covered them. But I would still just ask that, aside from what it cost you emotionally, did it cost you something financially also, and then physically?
Okay, so financially, yes, it did because I mean, just for ordinary medicine, I'm taking injection, and that injection is money. We don't. It's not called for. It's a normal thing that we're just supposed to go through and pass that stage and then continue our life, right? But taking injection, that was a whole lot every month, and it wasn't funny. It wasn't funny. You have to pay the nurse to come to the house. We have to pay the nurse to come to the house to give me the injection, and then I had to at a point stop working. So I wasn't even receiving any pay because they're always complaining that for a whole 5 days you just stay out of work, we'll take this out of your salary. And I'm like, you take out of my salary, what's it called remain now? May I come and just stop the work, may I come and stay for house. It's true. So it was it was not a pleasant experience. Then physically, um I was that anytime I'm seeing my message, I'll be drained. Like I can't the whole pain, the whole I can't even my people around me, my family, my siblings, my mom, my dad, I just can't talk to them. I'll just stay in the room all through, stay inside under the bed just to be maybe warm. I can't eat. I have to just taking pap. If I'm not taking pap, I'm taking no when you mix pap and you've not made it, I'll just be drinking that one or drinking Lipton
Wow.
constantly. Because that was that was it was not like a craving. That was the only thing I can eat that period or
I
something.
understand.
So and then the flow was crazy. It was really really crazy. So I have to just I'm always wearing I'm always doubling my pants. I wear the pants with pads and ah, when I wear clothes I can't wear kind of clothes I want to wear during that period. I have to be selective. And I'm like no, this cannot be happening. I have to be proud and I have to live my life normal without anybody knowing that okay, this is happening. Oh yeah, that was it.
Right. Okay.
So
Yeah. I'm so sorry again that you had to go through all of that, and I can relate to that injection part because that's like part of my story also. So, and I know that it's not something easy to always go to the hospital every other month for injections because of menstrual pain and the way people always look at it. Maybe just this simple menstrual pain. So I must commend you because
right.
you're really strong having to go through all of that, right? Why two times because of the same issue. I mean, you're so strong. Thank you. So I want to ask
Thank you very
if
much.
you had any advice to give any lady listening to this right now, what would it be?
Okay, so my advice is know your cycle, know yourself, know what is good for you. So I would say one of my problem was, I don't know, I was taking sugar without thinking. I mean, I have to take sugar, whether or not. I think that was my one of my problems, and I don't know if I should say this, or taking contraceptives and the rest. I think it's disturbed my cycle a lot,
Yeah, I did.
and then and yeah, basically just know your cycle, know your body, know what is good for you, and do it. And then if you can't handle it, maybe it's something that is, see a doctor, or I mean, there's we have Dr. Perfecta, Renoma, Women's Aid. So you can visit them on Instagram and you talk to them. They would help you just see you through all these pains, and then you get yourself back.
Right. Thank you so much. Thank you so much. I was going to ask you if you were doing something like right now to understand your body better, but you already chipped that in. Right. Thank you so much for being a part of the community, and then like for doing every single thing that we're asking you to do so that you can enjoy a pain-free cycle and understand your body. Thank you so much for choosing to share your story with us. We really, really appreciate you.
I'm grateful. I'm grateful for the opportunity. Thank you very much.
Yeah.
Disclaimer: this is based on someone's true life story, and the instances mentioned might not necessarily apply to you. Seek to find out your specific health situation and solution from your healthcare provider or any other certified healthcare provider. If you'd love to share your story with Renama, visit www.renomaholistichealth.com/SYS form and follow us on all our social media platforms at Renoma Holistic Health. Till I come your way again, remember, your body is not a storehouse for pain. Don't get used to it. Don't nurse the pain. It's not your baby.